Okay, I'm going to crack on. So there was a conversation about Raspberry Pi. Gioconda was in our room, and so they explained a lot about that for us and gave some hints on websites that we can look at. So we can share that. I'll share that in the chat now. There was also a conversation around security protocols and expectations. So people were, talking about how some platforms are now not being used by schools. In our room, we mostly had people who were either looking at it from an education perspective, or we had a couple of people interested in food growing and permaculture as well. And so more skills-based, skill sharing. And then people are very much at the start point of developing materials and, developing what platforms they should use and how they should use, if apps were the things to be looking at, as well as online platforms. Gaps in knowledge. We were talking about the need to look at what is happening in Wales and to see whether that would inform what we're going to be, how we approach things internationally, what resources we can share on Rachel. I think Howard and Wendy have some information about that. And then there's interest in creating downloadable and offline resources. We talked a lot about the barriers of cost and data usage. And so we were talking about, low data. Really, everyone's really interested in finding low data, low cost solutions. I am finished, Emma. I'll put the links for the websites into the chat now so people can see them.
Fantastic, thank you very much. Can I ask group 2 to feedback?
Hi, I'm Kathy. I was volunteered to feedback. So we had an interesting discussion. We talked about disability, those people with disability, and empowering them to be able to share their experiences and using that. That's what people have been using online learning for. It was interesting to hear about the experiences in Uganda, where there's been Linda had been, as part of Jamie Fund, have been doing COVID-specific webinars out there. Their limiting factor has been access to the internet, which touches on what Kath had mentioned as well. The hospital internets that they were using were overwhelmed, so they thought of buying personal mobile allowances for people, but because of the situation, even mobile data is being overwhelmed as well. So technical issues is a real issue. We also talked about future-proof, that any solution should be future-proofed. We should be looking for how it can be sustainable and getting maximum value for minimum investment. And the idea of, e-learning situation, perhaps repurposing materials or ensuring your materials themselves can be repurposed by others. And we got some advice that online learners' attention can be reduced. So short, punchy portions of information, 12 to 15 minutes max, is good practice, and that learners tend to feel isolated. So if you can do anything to nurture them as a group, that's good. So for example, weekly discussions or anything that there's interaction between the team.
Thanks, Kathy, that's brilliant. Thank you very much. Group 3, I ask you to just feedback, please.
Yeah, hi, it's Beth from Cymru, Africa. I think I nominated myself, but if anybody else from the group wants to chip in, please feel free. So similarly to the other groups, we talked about the move from being email-centric away to being, finding different ways of communicating with partners, particularly through WhatsApp, and bearing in mind, again, the sort of bandwidth and data limitations that perhaps some of the groups we work with have, and making sure that documents that we send are you know, are shrunk down so that they're easily transmittable. We had discussions around Wi-Fi access, and Alan Owens very kindly told us about some drone Wi-Fi technology that has been available in emergency situations through the Red Cross and other organisations, where they can fix a Wi-Fi hotspot to a drone. In fact, Alan, I can see, has put some links in the chat if people are interested in that. Particularly, you know, to reach one of the groups that was in my room was working with girls that are right out in the rural bush, and trying to sort of you know, get internet access for them obviously is a challenge. We talked about the usefulness of WhatsApp, and then the gap in sort of implementation support, and how important it is to have a trusted partner that's both trusted by, you know, the groups in Wales, but also trusted by the communities that you're working with, because obviously with the fact that we're not able to travel, you know, we need to be certain that our partner organisation is able and willing to implement the projects without our direct input. So so those were the main points we talked about, and gaps in knowledge were about using Zoom effectively for online meetings and webinars and animations, and how those can be useful in terms of overcoming language barriers and literacy barriers. So I think those were the main points, unless anybody else from our group wants to add anything in.
Great, thanks very much, Beth. And can I ask the last group, Group 4, please, to just feedback? Thank you.
Hi, so I was going to give some feedback from the from Group 4. So I think across the people who were in our room, there was quite a range of the sectors that people were working in. But I would say probably more at the early stage of thinking that they would like to use some forms of digital tools, but without having so much experience of using those within their development work. However, a few people have experience from outside development or from previous roles. So Roger fed back that when thinking about developing e-hubs, there can be difficulties around standards for translating into other languages. He was giving the example particularly for his experience, which is into Welsh, but perhaps that might be an issue for people here working in different local languages. And his recommendation was thinking about engaging with technicians early about this. And then Sarah in our group also spoke about her experience working some time ago in Uganda during the war. And she was working on a distance learning program out of Makerere University in Uganda, but this was before internet. And so she was talking about some interesting challenges of how you get paper into remote communities. But was talking about using existing channels, and so maybe there's something around whereas people are looking at it particularly in COVID-19, it doesn't need to be something that's sort of set up afresh, thinking about what they can sort of be what they can be based on, and how that can be sustained. And then when we were talking about gaps or questions, I think some of these things have been covered already, but just quickly thinking about the compatibility of platforms and what technology people have got access to, and connected to that, thinking about to make sure how you make sure that your work is inclusive, so you're not excluding people by requiring that they have access to internet or something like this. Also data, so talking about the cost for this, and really weighing up what is the most cost-effective way of getting of learning or getting information across or using these tools. I think in terms of thinking of, so quite a few of us were saying we're really sort of starting from scratch and feel like a big challenge is just not knowing what's out there, and so not knowing whether it's better to build on existing models or whether you need to start afresh. So I guess it's just that real need for some basic information, an interest in apps, and Fidili mentioned about the use of podcasts, so looking particularly at audio recordings potentially as a low-cost alternative to videos and films in terms of data needs, and then also lastly, there was a final point about the potential use of simulation for training and knowing and borrowing from telecommunications as well for advice, so sort of medical advice. And I'm going to put myself on mute.
Great, thank you very much, Tabitha. That was really good input and really useful to see what people are thinking about, and there's quite a lot of overlapping questions and yeah, the sense of what people are working on. I think we'll come back to that a bit later. I'm going to keep going for now and ask Julie to talk about her first case study on learning at Wales. Julie, are you there?
Hi, yes.
Hi, I need to make you co-host so that you can share.
Okay.
Actually, you want to,
Beth,
can I ask you to do that?
Yeah.
To make Julie
You
Rogers
can,
co-host,
bear
please.
with me. I'm not quite sure. Oh.
So her on, she's JU1.
Yes, no, I have her, but I can't. It won't let me to make her host for some reason. How strange.
Julie, are you planning to share a screen or anything?
Yeah, I've got the site up and ready. Or if not, we can talk.
Right.
Kath, it's definitely not. Is it diverted to you to be host?
It says I can't share the screen whilst others are presenting.
Ah, sorry, that's me. That's me. Right, sorry about this.
Right, let me try that again then. No, it still won't let me make you host, but are you able to share now?
Maybe change from speaker view to gallery view.
Ah, there we are. Great.
Has that come through?
It has, yeah.
Brilliant, thanks, Julie.
Brilliant. So my name's Julie Rogers, and my colleague Donna's on the call as well, just in case there's any questions.
Hi, I'm Donna.
Thanks, Don. And we manage e-learning platform called Learning at Wales, which is available to the public sector in Wales. Within the platform, we have about 350 courses that are available that cover a variety of topics, from your sort of health and well-being to your stat and mand training, and some general, IT, things like that. So there's a wealth of information on here. So the platform is managed and hosted by ourselves, but our team is actually funded by Welsh Government to support the users on this site. The users currently are both NHS, Welsh Government, the local authorities, we've got charities and voluntary sector, and the universities are also on the site. So I think we're up to about 350,000 users. So it's quite well used. What we also do is we support organisations in the development of microsites, so that their users can be directed to each organisation's landing page, which can be customised in line with your own sort of your logos or any brandings that you might have. And then within those microsites, they host various resources, courses, videos and things like that, which the employees can then access. For the courses that we build, so any courses that we build in health, we make openly available to all of the users on the platform, so anyone can have access to our courses. With the COVID crisis, we actually looked at pooling some resources together for ease of access. So we grouped a number of our courses so that users could quickly get in and look at modules that were available. Just looking at this list, you can see there's a number of different topics here, from infection control, DSE, food and fluids, safety and record charts. There's a number of modules around learning disabilities, basic OBS and things like that, mental health, manual handling, this one here in particular around your health matters. So you're all about health and well-being of staff, or how to look after yourself rather than just your core modules. There's modules in here that are available for information. We build the modules and make them as interactive as we can. We use a variety of formats, including animation, videos, scenario-based courses, and we maintain them so that all the courses are reviewed as a minimum on an annual basis, or if any changes are required, then they're reviewed prior to that, to keep things sort of in date and fresh, so when people go back to them, they're getting up-to-date information. So as part of our remit as well, we provide support to all our users and the organisations that are on the platform. So that is training on, if you were looking to build a microsite, we would provide the training and work with you to make sure that site is built as to your requirement. We would then provide training on how you could manage it, so how you could upload courses, resources, etc. yourselves. So there's a variety of level of access that we can devolve depending on how much or how little suits your needs, really. We also provide training on the development of e-learning, so actually building an e-learning product. So what the do's and don'ts, what that does look like, the sort of things you might want to steer away from. So we have an annual training program for that with organisations where there's a number of users that could potentially want training. We would do as bespoke training sessions for that group of users rather than expecting people to tap into the roll-in training program. So yeah, and also there's a variety of things that you can link in here. I think in the group I was in earlier, they mentioned about communication is key. So you can set forums in here for your users so that they can have that interactiveness regarding any particular topic that you want, really. And again, you can restrict that. If you only want certain users to have access, then that's fine. Or if you want to have more open access, then again, that's also available. So that's it in a nutshell.
What's the content management system of that, please?
It's a Moodle-based system.
Ah, got it. Yeah, thank you.
Thanks for that, Julie. It's really interesting. Has anyone else got any questions about the site or how it works or anything else?
No, Howard's question was in the chat, so obviously that's been covered off. Apart from that, nothing else has come up in the chat.
There was a question about if it's available offline.
It's not available offline, but all of the courses are compatible with apps.
Okay.
So you could access it via an app, and it's fully compatible with mobile devices as well.
Is it possible to download those courses and put them onto another system?
We tend to not make them sort of available on a different system. It's only because of version control and audit, so we know who's completed what at what point in time. You can certainly link it to other systems.
Yeah, well, our schools don't have access to the internet, so what will be ideal for us is to be able to download some of that content and add it to our existing results.
Because it's something we can certainly look at with you. So we just need to make sure that the courses would be compatible with whatever system they were looking to put it on.
Is there anything else? Julie, you mentioned when we spoke before, you had that list of the different things that you can use within Learning at Wales site for like the moderated discussions and the you can have lots of different parts of a module posted on the site, can't you, to make your module, and that you would be able to help people with putting that kind of flow together of how a e-learning process would work. Because I think that's something that people might have content and ideas of what they want to be able to use, but not understand how to get the outcome.
Yeah, absolutely. I mean, the system is really flexible into hosting or holding resources on it in a variety of formats. Like you mentioned, there's chat, there's feedback evaluations, forums, questionnaires. You can do surveys, you can coordinate workshops through years, so you can do like a virtual classroom sessions. You can host PDF documents or downloadable documents if you want users to be able to download them and save. So it's really flexible as to the type of resources that you can actually populate.
Great. Has anyone got anything else they want to ask specifically at the moment, or should we move on?
Yeah,
yeah.
I've got a quick thing if I can. I was trying to get into the chat, but I can't type that fast. I believe Veronica was looking at offline systems and supplying training material, but it would be version to that wherever that release date was. So it might be worth letting Veronica see this as well. Maybe something that she can incorporate on the systems that they're looking to deploy.
Yeah, I'm sure Sharon and I will bring that up with her. Thank you, Alan. Yeah, Sharon? Yeah, can't see Sharon at the moment, but yes. Yes, thank you, Alan, I will.
Great, I'm going to move on. Thank you very much, Julie. If you could just stay for the question bit in case there's more things that you could respond on, and I'll be sending out your contacts with the post-webinar email as well, so people can follow up with you if they want to find out more or have a closer look at the site.
Lovely, thank you.
So thanks very much. Great, if you could, yeah, thank you. And I'll invite Roland to, are you there, Roland?
I am indeed, yes.
Great. I'll just start. If you just let me know when you want to scroll down.
I will do indeed. Okay. Right. So if you go on to the next slide. Emma?
Yeah. For some reason it's not scrolling. Sorry. Let me just start again.
Emma, you need to enable editing.
Ah, thank you. Thank you. Last minute. Right, sorry.
Fantastic. So if you go back one, a bit of background on myself for the group. So thought to give you guys a bit of background on myself before touching on some of the work I'm doing with organizations within hubs Cymru, Africa. I've been working in IT now about 14 years. I've got experience across IT service management, software development, database development, data architecture, data science, big data, and operations management. In the past, I've worked within healthcare, customer service, hospitality, manufacturing, education, and fast-moving consumer goods. In my current remit, I work within the NHS, and I work in IT within the life sciences space. On to the next slide, Emma. So part of the ask for my presentation today was to talk about how apps could be relevant for international development. So over the years, I have found that international development and third sector organizations struggle to measure the impacts they have within the communities in which they work due to a lack of funding and data availability. A 2016 survey of 190 community sector organizations in Australia found that the most important driver for measuring impact was to improve services and to achieve their mission more effectively. And my takeaway from that is that that would be a shared requirement across most organizations today. The pressure for organizations within the sector is to show their impact because, as is the case within Wales, government takes a priority investment approach to funding. So spending decisions on social programs are increasingly taken on the basis of long-term economic and social impact of those programs. Next slide, Emma. Now, I'm just going to skim through this slide now. So the use cases for apps in an international development context would be for tracking progress on key development outcomes, tracking organizational resource, checking operational effectiveness, and checking organizational effectiveness. So for tracking key development outcomes, so Indicators that represent development outcomes that organizations are seeking to contribute to in partner countries. In this case, for example, with the work we do with ponds, we would be in the long term, after we're able to collect the data from these village health workers, we'll be able to track the contribution of those efforts to reducing child mortality and improving maternal health. We look to be able to put measures in place and track indicators, measuring outcomes that can be directly linked to organizational interventions. So for example, if on a country-wide basis, there's an improvement in child mortality and maternal health, we're able to then look on a regional basis to see what those improvements have been. And we're hoping to be able to link those indicators to the work we're doing within those particular communities. Next slide, Emma. So the work we're doing with PONT at the moment is we've developed a public health data collection app. Village health workers who go into communities are able to collect data from households within these communities. A number of years ago, PONT had a project where they delivered mosquito nets into the communities. And what this project allows them to be able to do is to quantify the impact of that investment in mosquito nets within those communities. So they're able to track incidents of malaria recently and in the past, able to capture information on things like if they have access to viable toilet facilities, if they have access to good drinking water facilities, that sort of thing. Now, the approach we've taken with PONT is we've taken a low to no code development approach, which means we're able to rapidly deploy data collection capabilities in these communities with the added advantage of these capabilities being available offline. As colleagues have mentioned in earlier conversations in our breakout sessions, part of the challenges you have in some of these communities are the fact that you do not have the technical infrastructure in place to support some of these technological approaches, in your case, the e-learning, etc. So what some of these newer low no-code technologies allows us to be able to do is to be able to have that offline capability to be able to utilize some of these new technologies. Happy to take any questions.
Hi, Roland. We have a question about, do you collect disaggregated data around disability?
No, not at the moment.
Is that something you plan? No.
So at the moment, our developments are very much led by the requirements of the organization we work with, and I am not able to speak to what their future plans are.
Okay. Does anyone else have any questions or comments about using apps in international development?
If that's all right.
Sure.
Tabitha. Roland, the app that you're using with PONT, was that designed from scratch, or are there templates that you can use, or existing ones that you modify?
That was designed from scratch. So part of my previous experience, as I mentioned earlier, has been as an information and data architect, and I've also worked in software development. So what I've been able to provide to colleagues within PONT has been I call it a full spectrum IT consultation service, in that I was able to sit down with PONT's representatives, gather their requirements, mock up an app for them that met their requirements, and develop that app within Google Cloud.
And is that something, so because Hub Cymru Affrica is a great group of organisations where there's sometimes some overlap in the programmes they deliver, is it something that once you've got an app that's designed for a particular organisation, that could be adapted for others if they've got similar programmes of work?
Absolutely so. So this is, I would recommend, and I did say this in my breakout group earlier, I would recommend as a collective that there might be some value to having a joint approach to some of this work, because you will find that some of these applications might be reusable across organizations.
And how would we do that? That's what we're trying to sort of get at, partly through the webinars, but also to, you know, to try and get a sense of what people are doing, and then what are the overlaps. I mean, is it sector specific? So the one that you're working on is in health. So it would only apply to health, or could you use an app, adapt it to use it in a livelihoods project?
You could adapt the app to be used in multiple contexts, but also what you could do is that the learning from this experience could be shared within other contexts as well. So for example, our low to no code development approach, that could be utilized in any sector. The way we've gone about the data collection, some of the lessons we've learned in going through this process and developing this app is a model that can be reused within any sector as well.
And yeah, carry on.
Sorry, and if I understood, so this app is very particularly for monitoring and evaluation, both of the organisation and of their the results of their work. Yeah.
Correct.
Is it something? How shareable is it? So in terms of for anybody to be able to download the app, are there particular licenses on it, or what restrictions are there when you do something like this?
So at the moment, we haven't whitelisted the app at the moment. So we're still very much in the development phase, and we're limited to a number of under 100 users. What will then happen is as we begin to scale up use of this app, which will mean we need to whitelist it, we'll need to pay a subscription fee on a yearly basis, and that will give us access to X amounts of users on an ongoing basis.
Roland, could I, a quick one? The app, the way they collect the data, does it display it on a map that can be used that can be used for analyzing geographic aspects of the impact, like GIS does? Can you query it?
I don't know if you can see my screen. Absolutely. So
lovely.
So I can have a map screen with all of my touch points on the map screen, and you can just click on individual bits on the map. It's all because of the platform we use. This is all built into the capabilities of the app. It depends on what functionalities you switch on and off.
Roland?
Yes?
How secure is the data, and is it only accessible to the individual user?
It is only accessible to the individual user and super users nominated by individual organizations.
That's brilliant. Is there a demonstration available somewhere?
I could record a video demonstration and make that available.
That would be great. Thank you very much.
I wanted to just cover something with, is it Tabitha that was just speaking a moment ago?
Yeah.
When you have your meetings and you're talking about what you like to collect, or it's a good idea to have people from other groups join in on their meetings, so that we can forward think of things that might come in the future and that. And I remember sitting in with Roland when we met with Pont, and it was they were only looking at the here and now, where I was looking at what couldn't come next and how can we build on the work Roland's about to do.
Great, yeah, thanks.
Is there any more questions in the chat?
There is, yes, we've had a couple. Well, firstly, a bit more explanation on DFID's 4-tier framework has been requested, if that's okay, Roland.
Okay, so the 4-tier framework is based on the DFID's 4-tier framework, and it's basically, I'll talk you through it basically. So how I think the apps could be relevant, yeah, you just went past it, within international development would be, one, tracking progress on key development outcomes. So your MDG goals, how do the efforts we're making as international development organizations contribute to the achievements of whatever Millennium Development Goals those efforts are contributing towards. Now, having the data available for analysis allows you to be able to link national level or regional level data to your local level data and be able to some degree quantify your contribution or impact of those efforts towards the high level national or Millennium Development Goals. With regards to organizational results, it allows tracking for indicators measuring outcomes that can be directly linked to organizational interventions. Now, the challenge I think I found at the moment, and think we're going to be dealing with this in future phases of the project, is that we haven't really articulated what these indicators are. So it's basically getting us from where we are now, which is just collecting the data to be able to meet our next round of funding. Not speaking for any organization now, but this is my perception of where we are generally. So actually going to a point where we can actually articulate what those indicators are we want to evidence, and beginning to describe how we want to measure them to allow us be able to evidence organizational resource. For operational effectiveness, again, it's all about indicators for monitoring organizations' effectiveness. So, for example, last year, we recorded 100 cases of malaria within a particular region. This year, we know we gave out 200 mosquito nets last year, for example. This year, we're only recording 50 or 20, being able to see the effectiveness of what we're doing within that organization. Within operations, and I think that overlaps to some degree with organizational effectiveness, because here we're monitoring improvements in the efficiency of the organization's internal corporate processes to help improve capacity to provide effective frontline delivery. If I've spoken too fast, or if you have any additional specific questions with regards to the fourth year, do fire away.
Lovely, thank you, Roland. And there was one other question around, does the app work offline as well as online?
It does work offline. That was one of the key requirements, because the IT infrastructure is not as good as you would like, particularly in the rural areas in parts of Africa. Having that offline capability was a critical requirement.
Thank you.
Great.
I'm just going to open it up a bit more to sort of broader discussion, so include, you know, you can carry on asking about the apps, but some of the questions that had come out of the groups earlier, we've got a little bit of time to go back to those and maybe see if anyone can input or yeah, has some insight into some of those questions that had come up. So I think if we go back to group one, one of the things that came up, you were talking about security protocols and expectations. Can you just, was that you, Kath? Group one.
Sorry, Anne?
Were you group one?
Yes.
In terms of the sort of the questions and gaps in knowledge that came out of your group, I think just to we've got a little bit of time to maybe discuss a couple of those other things that came out in the groups before we go on to next steps. And there might be somebody who can, you know, talk to those gaps or questions. So one of them you talked about, I think, was security protocols and expectations. Is that right? Can you just say a bit more about what that was, that point?
So I think that we had, it was Alison, wasn't it? Alison, you were talking about how you've been setting up groups. Is that right? Is Alison Rowland still here?
I'm still here.
Alison.
Oh, Alison. Sorry.
Alison.
Hi.
Go on.
Yeah, it was just an aside, something where we've setting up WhatsApp groups and things across countries is just sort of advice and awareness of protocols for when it's used for sort of discussion and sharing, and perhaps use of video clips. We're using it in schools, so video clips of children working and things. And just thought it'd be nice to have some sort of a checklist, if you like, of protocols and the importance that everybody in the group understands the vision and the purpose of the group. You know, often as the group expands, we've been asked to, you know, add people who, perhaps the headmaster of a school or somebody, and we haven't been strict enough in having almost like an induction or a vision statement or something like that, so that your group discussions and things can lose focus and be almost, you know, inadvertently hijacked, or if people become offended or something like that, you know.
Yeah, so that's specifically to discussion forums and WhatsApp groups in terms of the guidelines and what's acceptable and being very clear about the
I just wondered if anybody had sort of like a little, a little checklist or, do's and don'ts and things like that.
Does anyone? Kath, you want to?
Well, I just wanted to point out that Alan Owens has got his hand up.
Okay, sorry, Alan.
Talking then, so maybe
go, Alan.
Experience of that, Alan.
What we find that works really well with the WhatsApp is if you go on the header where you add people into the group, you can put a description in there. And if there's anything that you need to put as in housekeeping or sharing of data or information, we find it's really good to put it there because everybody gets to see that. And when we start the groups, we always talk about this content is we can only control the content while it's within the group. And if you decide to forward it, then you're taking full responsibility of that information that you're forwarding. But WhatsApp's absolutely fantastic because it's end-to-end encrypted. And it's only the people that are added into the groups can see and talk and chat and get to the material. So we can only rely that they're not going to forward it on to someone else. But it's always good to put a disclaimer in the top description part.
Mm-hmm. Okay. And I think you also kind of touched a bit there on consent for photos. If you're talking about sharing videos of children and things. Maybe that's something we could look at in terms of the hub advice.
Thank you.
Can I say, I think it's a good idea to CRB check everyone in your group or use whatever's equivalent in the country you're working in.
Yeah. I think we're getting into kind of safeguarding issues here as well, aren't we? Which maybe is another section that we also need to talk about. But I'm just going to move it back into the e-learning digital engagement focus. Another thing that came up in a couple of groups was the disability and inclusion and how you make sure that what you're doing is inclusive. And I know, Fadili's been working, I think, with you, Paul and Donald, on a specific kind of advice around online webinars, and we're trying to do our best to follow that advice. But I don't know if you want to just talk briefly about that. We'll share that paper when we send around the resources at the end of the webinar. But if anyone wanted to add anything or talk about that.
Just wanted to flag that Angie in the chat has shared some guidance on hand signals in webinars, which might be useful for people thinking of running them. So we'll make sure that's links in the resources we share as well.
Great, thank you.
Paul? Do I need to unmute Paul? Yeah, well done.
Okay. Something that's Donald, are you still there?
Yes, I'm still here.
Okay. Oh, I can see you now. Okay. Something that I'm aware of is that maybe it's not very technocratic at times.
Something that Paul has become aware of is that inclusion has become a very technocratic exercise.
Yeah. You do this and this.
For example, like you do this, then you include somebody.
I've got that. Is a question of trust.
In actual fact, inclusion is an exercise of trust.
Yeah. Can I trust you to include me?
Can I suggest that you include?
Oh, can I trust you to include me?
Can I stress that?
No, can I trust you?
Can I trust you to include me?
Yeah. and that's the key thing. That is the key. You can get around many technical issues. If that is the trust, if the trust is there.
And that is that you can get around technical issues, but trust is the key. Trust does have to be there.
Okay. Thank you. Okay.
Yep.
Thank you, Mrs. Paul. Thank you.
Thank you very much, Paul. And that, yeah, that's really, really important message, I think, for all of us, especially when developing these things. So yeah, thank you for your contribution. I'm just aware of time. We've got 10 minutes left. I know there were other things that had come up in the groups in terms of sort of gaps in knowledge and learning. And what I really wanted to talk about for a few minutes is what next. So how do we kind of, there's obviously a group of people who are starting to work in this area, and and I think there's a lot already that's going on in African countries that we don't know about. So it might, in terms of duplication, it's also looking at what's existing and supporting what's existing, not necessarily creating new things. And yeah, in terms of, I mean, the idea of kind of mapping what you're all doing. So it'd be great if you could put your details in the chat. I think some of you have, in terms of, with GDPR, we can't share your contact details with others unless you consent to that. So if you could maybe also indicate in the chat, put your contact details and your organization and say, this is what I'm working on. And then we could, with your consent, we can share that with others. I can also include, when I send the email out after the event, we'll put the table in so people can still add to that table, but just with the understanding that that will be publicly available. So you're consenting to have your contact details available to other people who are interested to see what's happening. The other thing, I'm just going to share my slides again. There's oops, I've done that thing again. Sorry. There's a discussion, we've been looking at whether we as Hub Cymru Africa could create a kind of discussion group and link to experts and that kind of thing. At the moment, I think the feeling is that it might be better to use existing forums that already are working with experts in terms of technical questions. So there is a Reddit group, which I could, Beth, could you just put the link in the chat? For some reason, my slides aren't doing what they're supposed to be doing. Let's just, oh good, that's better. There's a screenshot of it here, which isn't very useful, but anyway, that's what it looks like. But there's a Reddit is a forum where people, it's a discussion forum really, so people, you do have to join it and put contact details, but there is a specific Reddit on e-learning, so it's for people who are doing things in this area and wanting to ask questions. And I have contacted the people who host this Reddit. It's quite active, and I think there's 3,000 people who are in it, so there's obviously a lot of expertise. I did contact them and say, that there's people who are developing things for low resource settings. Can I direct them here? And they said, yes, great. I think they already have questions like that. So I'll put that in the email as well. So that's one place to go. And the other thing is, I'm collecting resources and tools. I've used these in the last webinar, but I'll send them with this one as well. Just a little bit of kind of technical guidance on different, for software and things like that. and tools for dissemination. And yeah, we've got a few minutes left. It would be good just to hear from you what you're interested in terms of what would be useful for you to take this forward, and what you want really. Because I know there's lots of you, we could do more case studies, lots of you are starting to work on this area, so we could have a forum where different people share their experience. Obviously online there are constraints, but does anyone want to say anything or put their hand up? I can't see hands, but if you...
Emma, can I jump in?
Sure.
I think one of the suggestions from Roland, as we're starting to look at pooling resources, where, so that not everyone is doing, there are crossovers with things. So I think from my point of view, to try to understand what some of those crossovers are and what people are working on, that would be a great help to get to that point. I'm certainly not there yet with the people in this group, understanding where everyone is, what are they working on, and where, I could pull in together with other people.
Okay. And is a webinar a useful way of doing that? I'm just trying to work out how you get to that.
No, because we have breakout rooms.
Yeah.
So you learn about what someone is doing in that room. And then the sessions are so short, they've got a specific question and you've got to address that question. So it's you're always saying, we've got to get back to the question. We've got to get back to the question. So I think even some sort of very low tech, Google Doc that people can populate and say what they're working on. And then that can be shared so that we've got a resource of contact information, what people are working on. That could be, just simple, a Google, a Google sheet or something like that could just be very easy. And if that goes along with the webinar, fine, but because the webinars are on topic, we don't have that much time, especially, to really learn about what everyone is doing.
Yeah. Does anyone else want to say anything? Any other thoughts?
Oh, sorry.
No, go ahead, Tabitha.
Okay.
Go on.
Oh, I'd be really interested to hear from Roland, just sort of a summary of what, and this is an example of taking it back to basics, what apps are actually, what functions they could play in gathering information for people working in low resource settings. So you spoke about this for PONT for assessment or monitoring and evaluation. I'm just sort of thinking some of the other things are like possibly for budgeting or for doing finances. Would it be something that he could sort of, knowing what kind of apps are out there, what kind of functions apps can do, and then could ask people here if any of, what of those functions would be of interest to them, and just think about this idea of, is there sort of a central template that could be built out for other groups? Because I imagine, well, I know for us as a small organization, building something from scratch is probably beyond our budget, but if there was a template that could be adapted, or sort of different organizations pooling resources, that maybe that could be a possibility.
Roland, are you still there?
Sorry, yes, I was just getting myself off mute. Right, so I think there's almost no limit to what you can do with apps. And again, I tend to be a big advocate for low or no code apps, which is where app development is going currently. I think there's no limit. So when I first started to get myself upskilled on app development, I found you could do quite a bit. You could do inspection apps, you could do product catalogs, you could do budgeting apps for finance, you could do surveys, you can build an e-commerce store, you could do inventory management, you name it. Again, I'm finding that it's the limit to how clever I can be in using the resources I have available to me within the framework. So intuitively, it might not seem like you can do certain things within the scope of the tool you're using, but I find that thinking cleverly, thinking a bit out of the box, I'm able to use a mix of tweaking the business process you deploy to achieve your aim and the capabilities of the app to get you to where you need to be. Does that answer your question?
Yeah, I think, I mean, Roland, I'll follow up with you, but maybe we can look at another way of having an app-specific Q&A and using that document, you know, if we have the mapping information and looking how to take that forward. We're just kind of running out of time. Does anyone else want to say anything about, about next steps? And
could Hub Cymru Africa have, as part of their website, a forum where we could all share our views and ideas?
Yeah,
Actually,
I can look at that. In terms of e-learning and digital engagement, yes, we might be able to. I don't know about the website, because we had discussed setting up a Slack group. I think Phil, if you're still there, Phil Hollington had drawn this to my attention, but which is for that. It's for sharing ideas and documents and discussions.
Most of the sites that I use have community areas, if you like, where people can ask questions and answer questions and raise concerns.
As opposed to a WhatsApp group.
Oh, very much so, yeah, because it'll be permanently online. So it's a way of posting a question to someone and hoping that people within the group will get back to you on it.
Yeah, we discussed this, having a Slack group with that. And one of the reasons that we didn't at this point put it together, because we thought we didn't have enough people who would have the answers, but maybe we do. So maybe we could trial it and see how it goes. So yeah, I can have a look at that.
Emma, I saw something in the chat, and I think it's, I know there are WhatsApp groups by regions. Yeah. And I just see that someone actually is suggesting themes. So you might instead have a health theme or a livelihood, you know, because at least, like I know in my WhatsApp group, you know, that could help, because at least then you're sort of partnering with people that are working in the same domain. It might not be in the same region. So that might be a nice way to just chat with people as well.
Yeah, we can look at it. I think it's the moderating of them, but yeah, they don't have to be.
WhatsApp groups kind of go on their own steam.
Yeah, I think we can make that in the descriptor, as Alan suggested. Yeah, well, that's great ideas. We're very short of time now. Does anyone have
perhaps in the table you're sending, put an extra column so people can enter which theme they want? Just give 3 and people and list.
Yes, good idea. Thank you, Sarah.
Quick thing, Emma.
Yeah.
Because we're talking about apps and IT, people usually create apps and they make them modular so that parts of an app can be used in other applications as well. So rather than breaking out into the subgroups that you're talking about, it's more of an overarching. We might use little bits of each in all of them. So unless we know that group's talking about it, we wouldn't know unless we were in that group, if that makes sense.
Yeah,
that makes sense.
Different ways of looking at it. So maybe we do need to have a specific e-learning digital engagement discussion, and then that can feed out.
Plus other things like a subject might come up that we've not even thought about in any of the other groups, and we would have missed it.
Okay, that's great. Have we got anything else in the chat? Can I ask Beth and Kath if there's anything else? And if not, could you...
Did you stop then? Because I unmuted. There has been quite a bit of discussion in the chat, mostly around the linking up and people collaborating together. So I think everyone's kind of given permission for us to share information if they haven't done it themselves.
Fantastic.
So yeah,
that's great. Thank you, everyone. Okay, I'm just going to wrap up because we're out of time. Could I please ask Kath or Beth to we've got a final poll, because obviously we have to look at how our webinars have gone and whether they've been useful to you or not. So we're going to do a quick poll here, but we'll also send you, there's a survey link that will come out, which we'll also put in the chat. You can put more information in it, so the poll's just a quick snapshot. So could I ask
It's not letting me do it. It says I'm logged in from another device and my polling session is inactive. So
that's what it says to me as well.
I think I've launched it, Beth.
Oh, brilliant. Okay.
Yeah, people are feeding in.
Good.
And
Beth, could you put the links in the chat for the Survey Monkey?
I have, yeah, I've done it a couple of times, so hopefully
Great, thank you.
People are doing the forms.
Great.
Could I request you to email the link to the Survey Monkey? I'm part-sighted and I really can't read it at all. Sorry.
Yes, no problem. We'll include that in the email.
Thanks, Sarah.
Okay, so we've had 19 people submit. Gone up to 20 now. We'll just give it another 10 seconds and then I'll share the poll results with you guys. Okay, ending poll. And I'm going to share the results with you. So I think people can see that now, but I'm not sure if Emma and Beth can, so I'll just see to pull out. No, mostly positive, people recommending HCA webinars and so forth.
Thanks, everyone. Yeah, anyway, it's good to get your feedback, and please give more specific things in the Survey Monkey if there's things that you'd like in future events or things we could change. It's all really useful for us to hear. And I'd just like to thank you all, really, thank you so much for your time, particularly to Julie and Roland for doing the presentations, and to all of you for attending and giving your input.
Thank you for setting this up.
Yeah, no problem. It's been good, and hopefully we'll take it forward and see you all again soon. So
thank you so much. Thank you.
you.
Cheers,
all
all.
right,
Goodbye.
Bye.
Bye.
Thank you. Bye.
Thank you.